Hey everyone! Today I'm going to be doing something a little bit different. I want to actually talk about an article I read today in the CBC News that I'm feeling pretty strongly about. It's an article called More Adults Are Taking Medication for ADHD. Physicians Say Trend is a Double-Edged Sword by Lauren Pelley. Initially I started off wanting to write a letter to the author about it, but I was a little too worked up to get my thoughts out coherently in a letter form. So I thought I'd do a video instead because I can get away with being a little bit spicier on YouTube. Once I'm calmer, I might still write a letter. And the article currently has more dislikes than it has likes, so clearly I'm not the only one who takes issue with it. October is ADHD Awareness Month, so I already wanted to do a video on ADHD, although this isn't the video I exactly had in mind. But before we get into the article, I want to make a few disclaimers. First is I have ADHD myself. I was diagnosed last year. I think it was in November, so I'm coming up on 1 year. So I do have a bit of a bias here based on my own lived experience as a woman who was diagnosed with ADHD in adulthood. My second disclaimer is I am not an ADHD researcher. While I have done a fair bit of reading on ADHD in my spare time, it's not my area of expertise the way something like complexity science or interprofessional education is. It's still something I'm learning more about. And a lot of the reading that I do tends to be more in relation to my own ADHD. And third of all, the article actually quite upset me. Not the entire thing, but there were some parts that made me quite emotional when I was reading it, so I'm feeling extremely frustrated despite having a smile on my face. So I'll probably be a little bit salty in this video, and I probably will have to edit out a very large chunk of this video once I'm done. So let's talk about the article. So to start off, I would argue that the title is misleading. More adults are taking medication for ADHD. Physicians say this is a double-edged sword. First of all, more adults are now being diagnosed with ADHD, so logic follows that you will see more adults who are being prescribed ADHD medications. And we'll come back to this idea later. But there's no mystery here for me, at least. And then the second part, physicians say this trend is a double-edged sword. I want to be clear in here that this author spoke to 3 physicians in total, and the author focuses mostly on one physician who's quite critical. And I apologize, I forget what the physician's name is. It'll probably come to me later. I do remember, though, that this particular physician is a family physician who, from what I could tell from doing some online sleuthing, is not an expert in ADHD. He seems to be more into exercise and nutrition in his practice. So he's really just speaking from his own experience as a family physician treating ADHD patients. While still an important perspective to consider, it really is just an N of 1, you know what I mean? This is something I would like to see included in a piece of research done, say, on physicians' perspectives of ADHD, not him speaking on behalf of the medical community on ADHD. But that's just my 2 cents, though. Maybe I'm completely mistaken here, or maybe I'm just reacting a little emotionally because some of his statements really irked me as someone who has ADHD. The author also talks to a researcher and professor from the University of Toronto who seems to actually do research in this area, so yay! He does work within the realm more so of, I guess, neurodiversity, broadly speaking, but he has done some work previously on ADHD, I believe. However, his contribution is limited to talking about potential side effects of stimulant medication, which we'll talk about later. But I'm not sure this particular physician is really trying to say that the increased use of ADHD medication is a double-edged sword, as the article implies. Rather, I think they're just trying to say more so that medications for ADHD, particularly stimulants, have side effects, which I'd argue we can say about any medication. And then the third physician that the author spoke to runs an ADHD center. I believe his focus is more so on adult ADHD specifically, so presumably he has a lot of expertise in this area, which is great. But from reading what he had to say in the article, my takeaway from him also wasn't this whole double-edged sword kind of thing. So I don't know, I felt like the title was quite misleading. And throughout the article, I got this sense that the author was very much trying to spin a very particular narrative, which I don't know, I guess I shouldn't find this wholly shocking because it is journalism and not research. I guess I'm probably just a little too used to reading research articles, but I'll highlight some of my concerns as we talk here. So there's 3 major themes that I want to talk about here: the risk of ADHD meds, the concern about overdiagnosis or increase in ADHD diagnosis, and then private clinics that assess for ADHD. And in some places, I'm going to pull upon literature to inform what I'm discussing about, and in some places, I'm just going to discuss my lived experience as someone who has ADHD and was diagnosed as an adult. So the first theme I want to talk about is risk of ADHD meds. So one of the concerns that is raised in the article is side effects from ADHD medications. And within the article, they are primarily concerned with stimulants, which within Canada and the US at least, tends to be the first-line medication for most people with ADHD, but certainly not all. They've also been around the longest for ADHD treatment. And within stimulants, we have methylphenidate, for example, Ritalin, which you may have heard of, and we also have amphetamines like Adderall. And they both work differently, but they both primarily target dopamine, which is a neurotransmitter. And stimulants are a controlled substance, and there is potential here for addiction and abuse, which the article mentions. I'd also add that stimulant misuse and abuse isn't limited to people with ADHD. People who don't have ADHD can also obtain them illegally and abuse them, for example, purchasing them to help them study for an exam, or stealing them from family members. It's also important to note that physical dependence, which the article mentions, is not synonymous with addiction. The Lancet Psychiatry recently published an article that explains the difference, which I'll link below if anyone is interested in reading it. So in short, physical dependence means that a person is going to have some pretty unpleasant physical symptoms if you take away their medication from them, also known as withdrawal symptoms. For example, antidepressants are dependence-forming despite not being addictive. So physical dependence doesn't equal addiction. And this definition isn't really teased out in this article, and it's brought up within the discussion of stimulant abuse. And drug seeking, unfortunately, is an awful stigma that's often associated with ADHD. And it can also be a barrier for being diagnosed with ADHD because there's an assumption that you're just a drug seeker. And it can also make it difficult for patients to access their legally prescribed medication. And for ADHD medications, there are also non-stimulant medications, like atomoxetine, which often is called by the brand name Strattera, which is what I take. Unlike stimulants, it targets norepinephrine. And atomoxetine is not a controlled substance, at least not in Canada, and there isn't considered to be that potential for abuse. There are also other non-stimulants like Wellbutrin, which I think is technically classified as an antidepressant, but that works for some people also in treating their ADHD. So back to the article. So the article also then talks about some of the scarier but rare side effects of stimulants specifically. And the family physician also mentioned that he's had some patients who have developed heart conditions triggered by ADHD medications. And yeah, sure, like stimulants are not safe for everybody, but we can also say that about a lot of medications. Stimulants can increase your heart rate and your blood pressure, and for most people this is fine and perfectly safe. For others of us, like myself, this is not fine. I take atomoxetine rather than a stimulant, despite it being the first-line treatment for a lot of people with ADHD, because I have an arrhythmia that would make taking a stimulant quite dangerous for me. And I think this sort of discussion and examination of the risk factors should just be a part of responsible prescribing, as well as involving patients in this discussion. Although I say that as someone with a background in nursing who now works in education, so I'm not and have never been a prescriber. When I was going through my diagnosis process, my physician was quite thorough. I had an ECG, I had blood work, I had an e-consult with cardiology. My doctor even emailed me a bunch of articles on cardiology and ADHD medications before we decided together what my treatment plan would be. The article also mentions some common side effects like suppressed appetite and problems with sleeping, which I also experienced on atomoxetine, and I also experienced it before I was on medications. For example, right now it's 9:30 at night, and I'm not sure when the last time I ate something was, because I've been so hyper-focused on this article all day. And this all becomes a part of that conversation between the provider and the patient, in my opinion at least. Sometimes there are other changes that can be made, or maybe it's not a good medication for you. And like I said earlier, medications often have side effects, and this isn't unique to ADHD, and it's really a matter of whether the benefits outweigh the negatives, in my opinion. So for me here, it just really felt like the author was trying to make it out that ADHD medications, especially stimulants, are scary and risky. Actually, that's not even my interpretation. She literally calls this section ADHD medication risks. But I think it's really important to take this all with a grain of salt, because while, yes, there is risk, side effects and risks aren't unique to ADHD medications. Like, go online and just read the side effects and risks for hormonal birth control, which millions of women take. And the discussion around the increase of diagnosis and potential overdiagnosing is where I really started to get upset while reading this article. So the article mentions that ADHD is very commonly diagnosed and shares a successful story from a social worker who also has ADHD herself, which is awesome. I enjoyed reading that part. But then we hit the but. And the article says, while many patients experience success stories, Victoria-based family physician Dr. Josh Levin, because that was the family physician whose name I couldn't remember, Josh Levin, said that there's a dark side to the higher rates of adult ADHD medication usage that isn't always talked about. The dark side here apparently is that we are maybe overdiagnosing ADHD and unnecessarily medicalizing people. And is that possible? Well, yeah, sure, of course. Or maybe, just maybe, people who were previously slipping through the cracks and are finally getting a diagnosis and a treatment for something that significantly impairs their daily life, and now they are able to live their life to the fullest. ADHD medication can be life-changing for those of us that really need it. I went through over 3 decades thinking I was lazy, messy, scatterbrained, inarticulate, daydreamy, stupid. You get the idea. And finding out that I have ADHD and being properly treated has completely changed my life and how I view myself. And his concern here is that patients who don't end up actually having ADHD may end up being treated with medications that cause more harm than good. And while, granted, it's a valid concern, ADHD can be tricky to diagnose, but from the readings I've done, in some populations, overdiagnosis isn't the problem. It's the exact opposite. It's underdiagnosis. And we're going to get into that specifically with my next theme. So at the end of the article, the author goes into the notion that social media is fueling the increased awareness of ADHD. And in my experience, as someone with ADHD, this is an issue that gets discussed a lot in the ADHD community, although the tone and the content of what specifically we discuss here is a little bit different. So ADHD has become this quote-unquote trend on social media, like TikTok and Instagram. For example, uploading quizzes, examples of symptoms, how it impacts people's life, day in my life, things like that. And this is good in some regards because it does increase awareness of ADHD, which the author acknowledges. I follow quite a few ADHD creators, some of whom have been really helpful in adjusting to this idea that I have ADHD and learning how to cope with it. How to ADHD, for example, is fantastic. I also just enjoy watching creators living their life with ADHD, and they may not even do content on ADHD, but just seeing them live their life with the same diagnosis makes me feel not alone. And sometimes it also helps me articulate my experiences to my partner and family who don't have ADHD. The article also mentions that there could be misinformation on these posts, which, yes, I absolutely 100% agree with, yes. Some of the posts out there are so ridiculous, and they promote stereotypes like ADHD is so quirky, or potentially increase the stigma surrounding ADHD. And this is really annoying as someone with ADHD because ADHD isn't fun and quirking. It's a disability. It sucks. There's some silver linings to it too, but I wouldn't wish this on anybody. So I'd argue that the real double-edged sword that's discussed in this article is actually social media, not increased medication usage. Where the author and I really start to disagree is this claim that this trend could be leading to unnecessary diagnosis, misinformation about how ADHD actually presents in people, and more interest in medications that not necessarily everyone needs. First of all, I don't think this trend should be leading to a lot of unnecessary diagnoses. More people seeking out help? Yeah, absolutely. And an increase of diagnoses overall? Sure, that logically follows that some of these people will have ADHD. And yes, we might have the odd person here or there that gets misdiagnosed. But if doctors are actually diagnosing people off of trends or what they're seeing on social media rather than evidence-based sources like the DSM-5, in my opinion, they have no business being a physician. In fact, from talking to other people with ADHD, it feels like misdiagnoses often goes the other way, where we're diagnosed with something like depression or anxiety instead of ADHD, or they want to treat for these comorbidities before they even touch that ADHD diagnosis. Like, I had an anxiety diagnosis for over a decade, which didn't respond to any treatment or therapy, before my new doctor assessed me for ADHD. And guess what? I don't have anxiety anymore. But I digress. We'll come back to this idea later. I've also heard people within the ADHD community having their concerns dismissed because physicians think that they just heard about it on TikTok and they want to be diagnosed because it's so trendy and doing it for clout. So some of these people who might very well have ADHD don't get assessed because of this myth that this author is perpetuating in the news. And look, I don't know if maybe there's statistics or some literature on this that support me, or maybe they contradict me. Here I'm talking as someone with ADHD who talks to other people who have ADHD. The author also mentions that many of these popular ADHD videos on TikTok are misleading, and even cites a study where they found that the videos don't instruct people to seek out actual medical advice rather than just resorting to purely self-diagnosing with ADHD. Which, yeah, if you think you have ADHD or you're concerned that something maybe is a little bit off, definitely go talk to your primary care provider. And I think this was a missed opportunity for the CBC article to tell people how to actually determine if the information they're getting is credible. Like with these ADHD TikToks, like what is the person's credentials? Are they bringing in literature, or are they just purely talking about their lived experience? Or perhaps they could have given readers some ideas of where they could get more accurate information on ADHD. And chad.org is a good one, which I'll link below. The article goes on to say that the full picture behind the rising rates of adult ADHD medication use remains unclear. And I personally don't think it's unclear at all. More adults are being diagnosed with ADHD. Plus, kids with ADHD usually grow up into adults with ADHD. I think the statistics are something like, I think it's like about 1/3 of kids who were diagnosed with ADHD as children no longer have ADHD as an adult, although it's not really clear why. But about 2/3 continue to have ADHD into adulthood. So if you have that plus new people being diagnosed, like yes, of course, the rate of ADHD medication is going to go up. So I don't think this rising rate of ADHD medication is what the mystery is, really. Rather, I think the question we need to be asking here is why are ADHD rates rising, especially in adulthood? And I don't think social media is a particularly strong argument for why this may be increasing. Could it be playing a role in people seeking out help? Yeah, absolutely. But I think there are other arguments that are more compelling, in my opinion. So first is the pandemic. So people with ADHD could be really reliant on routines to structure our lives. When the pandemic hit, many of us lost that structure, and we are now starting to see some research coming out of the pandemic era on how it impacted people with ADHD. For example, a recent meta-analysis found that children with ADHD experienced an increase in their ADHD symptoms during the pandemic. And Sibley and colleagues also suggest that adolescents and young adults with ADHD may have experienced worsening symptoms during the pandemic due to the need for increased self-regulated learning at home. And while people with ADHD can excel at many things, a lot of us do struggle quite a bit with self-regulated learning, myself included. And this new low-structure learning environment lacked the externally controlled school routine that may have been helping those with ADHD function previously. And I would argue that the same argument could probably be extended to adults with ADHD, and I've heard many people make this argument, including my own physician. Many adults, including myself, experienced a shift to online learning and working environments, removing that structure and those routines within our lives that we had built a lot of our coping mechanisms around. So for some people, symptoms may have become more obvious. It may have become more difficult to cope, which perhaps maybe is why they sought out help, leading to more diagnoses with ADHD. Another possible explanation for the increasing rates of ADHD diagnosis in adulthood is that more women are being diagnosed later in life. In fact, females being underdiagnosed within childhood is a trend throughout the literature. The ratio of boys to girls diagnosed in childhood, I believe, is about 3-1, and in adulthood, some authors suggest this may be closer to 1-1. And there are a few theories on why more women aren't diagnosed until adulthood. So first, ADHD tends to present differently in girls than boys, with girls often exhibiting more inattentive symptoms and boys often presenting more of the hyperactive and impulsive symptoms. The latter is more disruptive in classroom environments, leading to boys being more likely than girls to be referred for an assessment in childhood. Second, girls and women are more likely to mask symptoms of ADHD due to societal expectations of how a woman should behave. In fact, I am masking a lot of my symptoms right now. It is very difficult for me to talk even this slow and sit so still. Due to masking externalized behaviors, women and girls may not be referred for diagnosis, or they may downplay their symptoms, leading them to be missed in the diagnostic process. And third is that physicians may lack knowledge about gender differences in how ADHD can present, or they may have difficulties separating ADHD from common comorbidities that we often see amongst women who have ADHD, for example, depression and eating disorders. And remember how I mentioned earlier that I was diagnosed with anxiety before I was even considered for ADHD? Well, I'm not alone. Women are more likely to be diagnosed with and treated for a comorbid condition before being recognized as having ADHD. One study found that 14% of girls with ADHD were prescribed antidepressants before being treated for ADHD, compared to only 5% of boys. And for many women, ADHD is an illness that you have to fight to get, so to speak. And women often feel like they have to prove their symptoms before physicians will even take them seriously and consider an ADHD diagnosis. So while this article is very concerned about people being overdiagnosed or being prescribed medications, many groups have been historically underdiagnosed like women. I've also come across some readings that suggest people of color are also underdiagnosed. And the last thing I want to talk about is private clinics. So the article also comments about how there's a rise in private clinics that will test for ADHD. So Dr. Josh Levin says, when we're in a clinic where we're being paid by the patient to look for something, I think that does change our thinking a little bit, and we're more likely to see what the patient is looking for, he said. And this sort of raised the concern about shopping for diagnoses. And is it possible that this could change someone's thinking? Sure, maybe. But I'd argue that the professionals at these types of clinics probably have a lot of expertise in ADHD and how it presents specifically in adults, because that's what they do every day. This isn't something that they see maybe a couple of times a week at most. This is their area of expertise. And since this is their area of expertise, they probably also keep on top of the latest research. At least I would hope they do. And someone may go the private route for a number of reasons. Like the author herself acknowledges that wait times can be really long for publicly funded assessments. When I was going through my assessment process, the wait time for a psychiatrist was insane, which is why I didn't go that route. My doctor said I'd probably be looking at least 1 year wait if I went this route, which sucks when you just want some answers and you want to get on with your life. And I think another reason to go privately is the fact that these people probably have a pretty good understanding of ADHD in adults, because that's what they do. ADHD does look different in adulthood than it does with children. And if someone's paying out of pocket for an assessment, I can see why they'd want to go for someone who specializes in adults with ADHD. And I think the real discussion point here should be that we need to make ADHD assessment, and just psychiatric and mental health in general, more accessible to Canadians. I don't think the options should be wait months or even over a year or pay out of pocket. Fortunately, there is a third option, in Canada at least, which is to have your family physician assess you, which is what I did. But this is all, of course, dependent on whether or not you have a family physician and if they feel competent in assessing and managing ADHD. Anyways, those are just my thoughts on this article. While I do appreciate more attention being paid to ADHD within the media, especially surrounding diagnoses in adults, I probably would have had a better day if I hadn't read this article. I felt like it was a lot of fear-mongering and perpetuating unhelpful ideas about ADHD, and it could be detrimental to people who have ADHD. For example, what if a physician reads this, learns that ADHD is trendy on social media, and then comes to the conclusion that that's why ADHD rates are on the rise? What if they then treat a patient differently when they seek out an ADHD diagnosis? Like, are they going to just assume the person just wants to be assessed because it's trendy or because they want medications? Regardless of whether or not they're social media, I don't think these concerns should be dismissed if a patient is bringing them to you. Moreover, I think there are other explanations for why we're seeing more adult diagnoses of ADHD, such as delayed diagnoses in women and the impact of the pandemic, although social media probably plays some role in this. And I'm sure there are many other reasons that I'm not aware of. Something I would have liked to have seen here was more discussion with actual experts on adult ADHD, more quotes from the actual experts that were interviewed, and the integration of more evidence into the discussion. As someone with ADHD, I personally think this article does more harm than good, but I obviously have a very vested interest in this topic and a very particular perspective. Anyways, I hope anyone who manages to stumble across this little rant finds it somewhat interesting. I know this is not what I normally do on here, but I don't know, it's what I want to talk about today, and sometimes doing something different is good. So thanks for listening, and happy ADHD Awareness Month to all of my ADHD peeps out there.